Hello, my name is Kaylee, and I will later be joined by my colleague Jenna. Thank you so much for joining us for our literature review presentation outlining the global incidence and health impact of antimicrobial resistance. Our presentation goals are as outlined on this slide to provide an overall description of AMR, or antimicrobial resistance, to identify health disparities, discuss methodology, significant findings from our literature review, identify specific AI tools as well as barriers of concerns and biases, review public health implications, and then conclude with practical recommendations for public health professionals.
Hello, my name is Jenna, and we'll begin by discussing the significance of antimicrobial resistance. According to the World Health Organization, in 2024, antimicrobial resistance occurs when bacteria, viruses, and fungi and parasites change over time and no longer respond to medicines, making infections harder to treat and increasing the risk of disease spread, severe illness, and even death. It is becoming more prevalent now than ever. Antimicrobial resistance disproportionately impacts young children, men who have sex with men, and racial and ethnic groups with higher obstacles. Urban areas and those with homelessness face higher levels as well. Antimicrobial resistance levels peak in the winter and spring. Public health support and resources, including standardized healthcare interventions and global access to effective antimicrobials, are lacking. Antimicrobial resistance is actively threatening human health and requires interventions and programs to combat it.
Our review was modeled after professional methodology and investigated the overall clinical and public health impact and significance of AMR. Outcome parameters included health-related outcomes and measures of various health interventions. A web search of databases, as listed in this slide, was conducted for peer-reviewed journals, government reports, and reputable newspaper investigations for sources published in the last 5 years. Our search strategy was adjusted based off of the specific databases, and keywords, as listed in this slide, were used individually or in combination with each other. Title names and abstracts were reviewed using a literature matrix and compared to inclusion criteria. Duplicates were then removed, and records that met criteria based on title and abstract were read in full. Data points were extracted, and this yielded a total of 33 sources. Pertinent information and data points extracted included demographics, study parameters and aims, methodology, and key outcomes related to inclusion criteria. Findings were divided by source type and analyzed for common themes, significant findings, and public health implications.
Our significant findings demonstrated overall concepts about antimicrobial resistance. The first trend is an urgent global increase, with antibiotic resistance deaths increasing by over 80% from the years 2016 to 2019. The future of global health is also jeopardized, as the United Nations estimates that resistant infections could kill nearly 10 million people annually by 2050. In conjunction, the economy could witness a recession similar to 2008 due to increased care and resources in the healthcare. Continually, according to the data compiled, several factors contribute to antimicrobial resistance. The intensity and widespread disease outbreak of COVID-19 in 2019 and 20 served as a catalyst to this silent pandemic. One of the most pressing issues leading to antimicrobial resistance is the human-driven inappropriate use. Overuse and excessive antibiotic prescriptions in medical facilities create resistant microbes. Environmental transmission routes due to increased travel, agriculture, and wastewater hygiene increase widespread occurrence. Also, inadequate education is another factor that contributes to the issue. Climate change and pollution both increase disease and subsequent resistance through rising temperatures and contamination. Our findings also demonstrated common themes and data on topics that alleviate antimicrobial resistance. Early detection of the potential resistance results in more effective treatment and use of hospital resources. This leads to shorter medical intervention and more successful treatment outcomes for patients. A common theme was the use of shorter courses of antibiotic treatment. In many cases, the use of a 5-day course resulted in lower antimicrobial resistance than the standard 10-day course, while still providing favorable outcomes for the patients. Globally, vaccinations help alleviate the burden of antimicrobial resistance. Lower respiratory infections, tuberculosis, and bloodstream infections are all common examples of diseases that can be prevented with vaccinations, leading to lower resistance development.
There are many variables related to patient care and medical history, which can make management complex. Systems based on machine learning have been developed to assist with this. APSS is an antimicrobial monitoring system that's able to learn new rules and respond to user feedback for prescription surveillance. It can help with the transition from IV to oral antimicrobial therapy and identify inappropriate prescribing practices not supported by local antimicrobial stewardship experts. Sets of AI algorithms, including random forests, which aggregates the results of decision trees, can be used to identify predictors of clinical outcomes using clinical, lab, and pharmacokinetic variables. Our analysis showed that the applications of AI in healthcare and in the context of AMR are endless, contributing to a reduction in antimicrobial development time, greater diagnostic and therapeutic appropriateness, and predictive outcome analysis. It can help with rising healthcare costs and staffing shortages, and to promote appropriate antibiotic prescription. It's important to keep in mind that AI is only intended to be a part of the clinical decision-making tree. There's also a great need for more randomized clinical trials that demonstrate the reliability and improved effectiveness of AI systems compared to or in combination with traditional systems. There are also great strides needed to raise more awareness about AI and its applications in the medical community. Another limitation is the potential bias that these systems may pose, as they are often based on studies, databases, and guidelines and may not be representative of all patients. There's a large amount of data needed for accuracy, which poses concern in terms of patient privacy, security, and consent. Overall, further studies are needed on ethical, regulatory, and practical considerations required to use AI widespread.
Our comprehensive literature review yielded common themes of public health implications. The most pressing factor is higher mortality rates. As a result of the resistance, known treatments for common infections are no longer effective, and at-risk populations are more vulnerable to serious complications and even death. Increased global burden of disease is also concerning and expedited by international travel and agriculture, which aid widespread AMR. Higher rates of disease transmission are also seen with the emergence of superbugs, which are bacteria that become resistant to many treatments and result in lower infection control and prevention. Further implications are higher stress levels due to media portrayal of antimicrobial resistance. Fear mongering instead of empowering the necessary education needed to address the issue is detrimental to its progress in the future. Lastly, a higher economic burden on healthcare is being faced due to antimicrobial resistance. Longer treatment cycles, ineffective treatments, and longer and more frequent hospital visits and stays create higher healthcare costs for patients and providers, which most notably is pressing in lower income households.
Given the disparity between the different methods of analysis of anti-infectives, we clearly identified in our review that there is an urgent need to standardize anti-infective susceptibility testing techniques to have minimum inhibitory concentrations for antibiotics to homogenize interpretations. In the future, the various surveillance systems should have, in addition to microbiological data, demographic and clinical data to facilitate understanding of the phenomenon of AMR. These data points, once collected, would allow public health professionals to monitor the evolution of AMR and set up registries of mortality rates due to AMR to fact-check and avoid the fear caused by alarming published studies and reports. Antimicrobial stewardship, an organizational or system-wide healthcare strategy, is designed to promote, improve, monitor, and evaluate the rational use of antimicrobials to preserve their future effectiveness, along with the promotion and protection of public health. It promotes antimicrobials' appropriate use by implementing evidence-based interventions. The One Health approach, a holistic and multi-sectoral approach, as well as evidence-based vaccination protocols, health professional education, and the improvement of public awareness about AMR are all needed to address AMR's rising threat. Thank you for your time and attention. The references for our sources are included in the following slides.